Good morning. Cardiac arrest can happen to anyone, anywhere, anytime, at any age, and it often happens without warning. Cardiac arrest is when the heart suddenly and unexpectedly stops beating. When the heart stops beating, blood stops flowing to the brain and to vital organs. Brain injury can begin within 5 minutes. Only fast action, doing CPR and using an automated external defibrillator, or AED, can double the chance of survival. Roughly 60,000 out-of-hospital cardiac arrests happen every year in Canada. That's one cardiac arrest every 9 minutes. Surprisingly, nearly half of these cardiac arrests happen to those under the age of 65. And only 1 in 10 people survive an out-of-hospital cardiac arrest. Doing CPR and using an AED can double a person's chance of survival. And while CPR rates across the country vary from 42 to 72%, the use of an AED by bystanders in public places is as low as about 13%. We need to get that number higher. That's why my colleague John Fraser and I are here today. In 2013, Manitoba introduced the Defibrillator Public Access Act, which required that AEDs be placed in high-traffic public places and be registered with 911. Here in Ontario, in June of 2020, we passed the Defibrillator Registration and Public Access Act, requiring that all public spaces be fitted with an AED and that such a public registry be created. There are thousands of AEDs across the province, but unfortunately, we don't know where they all are, and that needs to change so that bystanders can provide life-saving care and support to their neighbors and friends who are in distress and risk of death.
Thank you, Stephen. And, we've heard us talk a lot in the last few days about access to family physicians and 2.5 million people who don't have a family doctor. We're here today to talk about when people are in crisis, are suffering a cardiac arrest, and how do we ensure that they get the care that they need, and that who's ever at that arrest, at that event, knows where a defibrillator is and that it works. So the history on this is, the bill is called the Defibrillator Registration and Public Access Act. It was actually introduced and debated first almost 5 years ago. At the time when we passed the bill, both myself, Frangelina, Robin Martin had the same bill. We passed Robin's bill. I asked the then House Leader at the time, Paul Calandra, that we travel the bill, because we all agreed on it, and that we should pass it. And in June of 2020, it was passed and it received royal assent 4.5 years ago. Now, the purpose of a registry is, as Stephen said, is so that we will know where AEDs are in the case of an emergency. That emergency services will know and be able to say, there's a defibrillator just around the corner, or down the street, or in this office. Because time is important when people suffer cardiac arrest. The other important part of the registry is we have to know that it works. Defibrillators have to be maintained. And the registry establishes the same kind of requirement that we have for fire extinguishers here in Ontario. So it's not something new. There are very important reasons to have this registry. So all parties agreed. And it's been 4.5 years. We all know the registry is important. emergency services tell us that. We all know that. So why has nothing happened? It's 4.5 years later. Nothing. Nothing but crickets. We don't have the information that we need to build a map to tell people where life-saving equipment is, where defibrillators are in this province. We don't. But you know what? We have a map that Premier Ford is really proud of. And that's a map that tells you where you can find booze, as if we need it. We don't have a map for life-saving equipment for defibrillators, but we have one to help you find booze. So my message to the Premier is, our message to the Premier is, Premier, the cheese has slipped off the cracker again. You need to take action on this bill and take it today. Thank you.